So I'm doing my case study on breast cancer. Here goes some anatomy. I have the mammary glands, axillary lymph nodes, fatty tissue, fibrous tissue, the areola, the nipple, and the ducts. Epidemiology. Breast cancer is the most commonly diagnosed cancer among U.S. women, with an estimate 268,600 newly diagnosed women with invasive disease, 48,100 cases of ductal carcinoma in the stool in 2019, accounting for approximately 15.2% through 30% of all new cancer cases are in women, among women. Each year, nearly 42,000 women die of breast cancer, making it the second leading cause of cancer deaths among U.S. women after lung cancer. Histology and pathology. The vast majority of breast cancer arise from epithelial cells lining the terminal ducts, lobular unit. Some tumors do show distant patterns of growth and cellular morphology, and on this basis, certain types of breast cancer can be identified. Those with specific features are called invasive carcinoma or special types, while the remainder are considered to be no special types. Route of spread and distant metastasis. The most common breast cancer metastasis sites are the bones, the lung, the brain, and the liver. The route of spread is the lymphatic system. So my patient is 31, a woman, and white. Risk factors: gender, genetic mutation, family history, dense breast, reproductive history, personal history of the breast, which just means if you had breast cancer before, it's a chance of getting it back. My patient presenting symptom was she had a lump and she also had breast pain. She had no medical history on file, but the social history was alcohol use was not often and tobacco use every day. Diagnostic workup: she had a mammogram and a biopsy. Sorry. The confirmed pathologic diagnosis was C50.811 malignant neoplasm of the right breast, T3N1MO. What's the stage and grading? Staging system, TNM. The size of the depth of the primary tumor, whether the cancer has spread of the lymph node, and whether the cancer has spread to another part of the body. Treatment modalities: chemotherapy and radiation therapy was used. Treatment goal was definitive. Here's my treatment prescription. I also wrote it out on the next slide. The prescribed dose was 44 gray, 2 gray per fraction, number of fraction 22, energy 18 MV. External beam technique was the VMAT. Patient setup: supine wean board, wedge underneath, and the headrest B. No boost, no brachytherapy. Here's my atomic drawing, my DVH. Critical structures was the heart at 4,500 centigrade, lungs at 2,000 centigrade. Side effect: skin irritation, fatigue, breast swelling. Follow up: patient is still under treatment. The prognosis and 5-year survival rate. The average 5-year survival rate for women with invasive breast cancer is 91%. The average 10-year survival rate for women with invasive breast cancer is 84%. If the cancer is located only in the breast, the 5-year survival rate of women with breast cancer is 99%. And here are my references.